University Medical Center Policy Education. According to University Medical Center's Intravenous Medication Administration Policy 301, a licensed nurse is responsible for identifying solution compatibilities, rates, and authorization in accordance with guidelines of this policy. Must administer medications within the scope of the Board of Nurse Examiners, clarify any order treatment that is inaccurate, non-efficient, or contraindicated by consulting with appropriate licensed practitioner. According to policy, LPNs shall not engage in IV therapy related to either peripheral or central venous catheters, including venipuncture, administration of IV fluids, and/or administration of IV push medications until successful completion of a validation course, the UMC IV therapy course. According to policy, make sure that you prime tubing before administering any fluids or medications. Check for incompatibilities. Do not administer if precipitates or unexpected occurs. Staff are to pay special attention to the primary tubing strip rate. A pump is to be used on all intravenous fluids that have special medication added, for example, heparin drips, chemotherapy, insulin drips, potassium bolus, etc. Piggyback medication should not be infused into the same line with total parenteral nutrition, lipids, or blood products. When using piggyback infusions, care should be taken to prevent contamination at injection sites. With secondary infusion, make sure that you're using the back priming techniques. The attachment is included with this policy. Intermittent infusion lines are flushed with 3 to 5 milliliters of sterile saline for injection before and after intravenous piggyback or intravenous push medication, or once a shift. NICU and pediatrics in the critical care will follow their own policy and procedures. Intermittent infusion lines should be DC'd if not utilized within 48 hours to prevent complications. Hang times for various types of IV solutions are as follows. Manufacturer pre-mixed standard IV fluids, normal saline, LR, D5NS with 20 of potassium, will hang for 96 hours. IV fluids mixed by pharmacy or nursing and all IV infusions containing medications, for example, heparin drips, insulin drips, dopamine, etc., will hang for 24 hours. Parenteral nutrition with and without lipids will hang for 24 hours. Propofol will hang for 12 hours, and blood for 4 hours, or no longer than 4 hours. Also note, per policy, narcotic analgesics or other medications utilized for moderate sedation require the responsible physician to be in the hospital and readily available to the department during administration unless a patient is already on the ventilator. Refer to Sedation Policy, Patient Care 36.1. According to policy, neuromuscular blocking agents are not to be administered in the medical surgical environment except in emergency care situation with physician present. Medications administered only in critical care environment include thrombolytic infusions. Heparin is the only thrombolytic that can be administered on a floor. Insulin drips, vasoactive infusions require frequent titration, Haldol in IV or IM form. According to Medication Administration Policy 301, medications administered as continuous infusions via large volume infusion pumps in the critical care setting include morphine, fentanyl, Versed, Ativan, Dilaudid, and Propofol. According to Medication Administration Policy 301, medications may be administered in the Intermediate Critical Care Unit, or ICCU, Burn Intermediate Care Unit, include hypertonic saline, diltiazem, amiodarone, lidocaine, procainamide, dobutamine, Natracor, nitroglycerin, heparin, integralin, argatroban, Riapro, Cardine, and dopamine. Up to 2 infusions may be administered but not require frequent titration. Monitoring that requires vital signs more frequently than every 2 hours cannot be provided in intermediate care. According to Medication Administration Policy 301, antiarrhythmics may be administered on general adult nursing units under certain circumstances. Those medications include amiodarone, cardizem, procainamide, heparin, and argatroban. Note: no more than 1 antiarrhythmic drug per patient is allowed in the general nursing unit. These medications may only be given on the general nursing units if the patient is deemed to be stable by the physician. The patient requires telemetry monitoring only, and vital signs are required no more than every 4 hours. After completion of the initial vital signs of every 50 minutes for an hour, then every 2 hours for 6 hours, and then every 4 hours. According to Medication Administration Policy 301, the attachment includes specific medication guidelines for infusions. With insulin, make sure that you prime tubing to allow for absorption of insulin. 2 licensed personnel must check mixing and dosing. With heparin, 2 licensed personnel must check dose and rate of infusion. With heparin, monitor vital signs hourly during infusion. Check for crystallization. At low temperatures, mannitol may crystallize. Mannitol is stable for only 24 hours after opening and requires administration via an inline filter. With Pitocin, post-delivery, the maximum amount of Pitocin is 30 units per 1,000 mL. With sodium chloride, the maximum for 250 mL and 24 hours for 5-eth administration. Additional doses require ICU. According to the Medication Administration Policy 302, an RN or an LVN who has completed the IV therapy course that you're completing now may perform intravenous therapy. 2 attempts per nurse will be allowed. The maximum of 6 attempts by the nursing staff will be implemented, and then the charge nurse is to be notified. House supervisor rapid response staff will be available. Must maintain standard precautions. Peripheral sites will be changed every 96 hours. Peripheral and central line tubing will be changed every 96 hours. Peripheral site is evaluated and documented at least every 4 hours. For instance, skin status, signs of infection, infiltration, and mobility limitations will be documented. According to policy, a pump is to be used on all intravenous fluids that have special medication added. For example, heparin drips, chemo, insulin drips, potassium boluses, etc. Intermittent lines should be discontinued if not utilized within 24 hours. Prime tubing before administering any fluids medications. Check for incompatibilities and do not administer any precipitates or any medication with unexpected color. According to UMC's policy, Medication Administration Policy, Pediatric Patient IV Therapy 307.5, check IV sites every 2 hours and document. IV pump volume limits will be set at 2-hour intervals only. Peripheral IV INT therapy, according to DPP Policy 823, pediatric peripheral IV sites will be changed only if complications arise. All medications, fluids for pediatric patients must be administered via infusion pump. According to the Neonatal Intensive Care Specific Policy 529, LVN responsibilities, no more than 2 attempts. If failed, notify the charge nurse. RNs and MDs or physicians may take 2 attempts. If failed, seek assistance from another RN or MD. Total number of IV attempts is 6. Taping, the chevron technique, and bioclusive dressing is preferred.